The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. I'm Dr. David DeRose, and with me is Dr. Tim Arnott. Good to be with you, Tim.
Thank you. It's good to be here.
You know, Tim, as we work together at the Lifestyle Center of America, we often come across some very surprised patients when we get them on a treadmill. You know what I'm talking about?
Yes.
Can you remember the last time you had a patient who came with no awareness of heart problems, got on the treadmill and learned something they weren't expecting to find?
It can actually be quite a shock, actually.
Stress tests are used widely today to try to identify early signs of heart disease. And although we think we've heard plenty about heart disease is still the #1 killer in America. Perhaps most shocking, many people who have the beginnings of heart disease are totally oblivious to the condition. Dr. Arnott, how can someone have any awareness of whether they have heart disease, whether they're at risk? What kind of issues should people be thinking about, especially some of our viewers today who may feel, well, hey, I don't need to be listening to this show today. Heart disease, that's not one of my problems.
Well, I think it's important to understand that heart disease is rampant in this country, and probably most individuals have it. In fact, we're told that there are certain studies that reveal that heart disease starts even before the infant is born.
Now, wait a minute. You're telling me most people in America have heart disease? They've been to their doctor, the doctor listened to their heart, checked their blood pressure, their cholesterol, he said they were fine.
That's true, but what we don't understand in this country is that most of us have cholesterol levels that are too high. And it puts us at risk for the development of atherosclerosis, this filling up of the arteries with cholesterol.
Now, what about the folks tuning in today who say, hey, cholesterol, that's not an issue for me. I can eat anything I want. You know, you just put the whole spread out there, and I can eat it all. My cholesterol stays fine. Do they need to be concerned about heart disease?
Yes, it's true that they do, because even if you have a lower cholesterol level, let's say it's between 150 and 200, you still are at risk of heart disease. In fact, over 35% of all the heart attacks in this country occur in individuals that have a total cholesterol between 150 and 200.
So I can walk into my doctor's office. I just had my cholesterol checked. I'm sitting down there with the doctor, and she says to me, well, listen, you're doing great. Your cholesterol's 190. I mean, you're better than most all my patients. But you're telling me that even that cholesterol is giving some increased risk.
Absolutely. Not only that, but now we're finding out that cholesterol is not all the same. There are certain types of cholesterol called oxidized cholesterol. Cholesterol that's been damaged. Cholesterol that has been injured by free radical damage. And that cholesterol is particularly damaging, and they're finding out now that individuals that have lower cholesterol levels, if they have a high amount of that cholesterol that's oxidized or damaged, that they are at high risk for heart disease.
So it's becoming very clear in the medical research area, and as we work with patients, that even people who think that they don't have heart disease often get some sobering wake-up calls, perhaps on a stress test, perhaps with chest pain, or sometimes even with a heart attack.
Absolutely. In fact, one of the most common symptoms of heart disease is sudden death. And recent literature has indicated that about 1/4 and as many as 1/3 of all heart attacks are totally without symptoms. In other words, the patient has the event, but they're not aware of it until later.
And this is more common in people with diabetes and other conditions, isn't that right?
That's true. And the other thing is they've discovered that even in these silent heart attacks, they have about the same risk of dying after one of those silent heart attacks as if they had symptoms with a heart attack.
So really, heart disease is a bigger subject than often appears on the surface.
Absolutely.
The other thing that's interested, me, Tim, lately is I've looked at some of the medical research literature that's been coming out. I mean, as you look through things that come across our desk all the time as physicians, I mean, they're talking about all kinds of new risk factors that are coming out. They're not new, but we're in the medical community realizing there's a lot more going on than just cholesterol kind of gradually building up on the wall of the blood vessel and finally closing it off. Really, in fact, our whole picture of the understanding of what causes a heart attack has changed. Could you explain that a little bit to our viewers today?
Well, we used to think that the main thing was that the cholesterol filled up the artery and it got to a place where the narrowing was so tight that blood couldn't get through there, and that was the big problem. But now what we're discovering is that there are certain cholesterol plaques, certain cholesterol lesions in the artery that are more unstable. They're more likely to rupture and to break. And at that point, when there's a rupture and a break of a cholesterol deposit, you get a blood clot forming. And that is what causes the heart attack, because the blood clot totally obstructs the blood from going downstream. And so the tissue beyond that obstruction dies, and you have a heart attack or a stroke. And so what we're focusing on now is whether lesions are unstable, ready to rupture or not, and factors that have to deal with that.
Yeah, this has really revolutionized a lot of the discussions in the medical research area. This is a 2001 paper from the American Journal of Cardiology. It says, what have we learned about the biology of atherosclerosis? What's happening in the blood vessels? And it says here, the key is the role of inflammation. And kind of going along with this description you just gave us, Dr. Arnott, Dr. Libby here with the Department of Medicine at Brigham and Women's Hospital, Harvard University there in Boston. He's talking about a review of what we're learning indicates that inflammatory processes are happening in the artery. Now this is, I can just imagine someone tuning in today and saying, what are they talking about? Inflammation. I mean, inflammation happens in the joints with arthritis. I mean, you can get inflammation, maybe with a pneumonia, but inflammation with heart disease, how does that fit into the picture?
I mean, most individuals, when they think of inflammation, they think of maybe they get a splinter stuck in their skin, and pretty soon that area gets red and warm and swollen and hot. And that, in a sense, is inflammation. But, in fact, what it is, it's an immune system that's revved up and ready to fight something. But it seems that in heart disease, we have an immune system, we have white blood cells that are revved up, they're producing all kinds of chemicals and mediators, and there's really no enemy to fight except this cholesterol that's building up inside the artery. And individuals that have more of that revved up immune system, more of that white blood cell function, actually are at higher risk for a heart attack. Because it seems that when you have a cholesterol lesion, a cholesterol deposit in the artery, and in an environment of lots of inflammation, lots of white blood cell activity, that those cholesterol lesions are more likely to break open, rupture, and a clot to form.
Now we're talking about some pretty esoteric stuff, and we really want to get to kind of the bottom line information. Someone tuning in today, they're listening to you and I speaking here. We're physicians. I mean, you have a specialty, a board certification in family practice, my specialization in internal medicine and preventive medicine. And people are listening to us talk, and they're saying, I mean, here's a couple of guys who say, heart disease is something going on in a lot of people's bodies. We probably all have some degree of blockage in our arteries. We need to be concerned about inflammation in the blood vessels. Maybe our past understanding of what a normal cholesterol or triglyceride was, maybe that's wrong, but what are people supposed to do about it? I mean, what kind of calls to action are there today for people, whether they walk into our offices or whether they're just tuning into this program? I mean, what kind of message do we want to give to people? I mean, is this something that we just have to hide under our beds, fearing when we're going to have a heart attack?
Well, I think one of the important pieces of research that I came across was presented at the European Society of Cardiology about a year ago. And this study showed that individuals that ate the most fiber, had the most fiber in their diets, actually had the lowest levels of inflammation.
And they were measuring this through
C-reactive protein.
Okay, C-reactive protein, this is another hot topic in the medical research literature. This is a 2001 article from the Cleveland Clinic Journal of Medicine. It says C-reactive protein, a golden marker for inflammation and coronary artery disease. So what you're telling us, Dr. Arnott, is these new things that are coming out in the literature seemingly every day. You're saying that some of the old-fashioned advice really makes a difference, eating more fiber. So make it practical for us. How do you get more fiber?
Well, you know, there's only one source of fiber on this planet, and that is 5 different foods: beans, whole grains, fruits, vegetables, and nuts. Those are the only sources of fiber on this planet.
Now I'm noticing a pattern here. These are all things that the Creator gave us.
Yes.
It's not these pre-packaged substances that have been isolated. It's not supplements, huh?
It's just the food that we find illustrated and highlighted in Genesis chapter 1 and Genesis chapter 3. It's God's original diet.
So now wait, let me just see if I've got this straight. You're telling me that this new evidence that's linking inflammation and coronary artery disease is actually encouraging us to eat more fiber?
Absolutely.
It seems there's a connection between high fiber diet and decreased levels of inflammation.
Absolutely.
So then, before this was even known about in the medical research literature, these plants had fiber in them, is that right?
Yes. People were reaping the benefits of a low inflammation level in their bloodstream by eating God's original diet, long before we ever knew about inflammation.
You know, Tim, this is what I think is so exciting about the Creator's program. You know, some of you have been listening to Dr. Arnott and I talk today, and you may be thinking, well, what is the hot new thing that these guys are going to tell us about heart disease? You know, what's the newest supplement that I can take? And actually what we're saying, one of the pictures that's starting to come out, and we'll flesh this out even more, is the simple foods that God gave us in the beginning: fruits and whole grains, nuts, seeds, vegetables, beans. These foods have some remarkable potential to lower heart disease risk. And it's even affecting risk factors that we weren't talking about even just a few years ago. Tim, let's talk about homocysteine in that light. Homocysteine is an amino acid, of course, a protein building block. What's your take on the medical research literature at this point? Is this something that people should be concerned about?
You know, actually, it's something that not only vegetarians need to be concerned about, but even individuals who are not vegetarians. And one of the things that we have to be concerned about is vitamin B12. And as we tell people, you know, eat more plant-based foods, eat more whole grains, beans, vegetables, fruits, nuts. As we give that advice, we also need to let people know that you need to get extra vitamin B12, because if you don't, you're going to be raising your homocysteine level. And now we know that individuals that have the highest homocysteine levels have higher risks of heart disease, they have higher risk of stroke, and they have higher risk of all-cause early death, including cancer deaths. And what they're discovering is the higher your homocysteine level, your higher your risk of heart attacks, strokes, and early death from any cause.
Now, let's just talk about this for a few minutes so we don't give people the wrong idea. Homocysteine, as Dr. Arnott has been mentioning, actually is something we have to be concerned about today. At the Lifestyle Center of America, we routinely measure homocysteine levels on everyone that comes to our program. And the reason why is, as Dr. Arnott mentioned, very important risk factor: heart disease, stroke, all causes of death related to homocysteine. But the mystery, as he's been pointing out, is that if you just eat a plant-based diet over the long haul and don't get adequate B12, you can get into problems with homocysteine. The irony is, what we found in our research at the Lifestyle Center of America, the plant-based diet lowers homocysteine to begin with. Now, Tim, I can imagine people listening to us, they're saying, I mean, this is starting to sound a little bit like, you know, gobbledygook, or I don't know what they're going to call it. But they're saying, look, at one doctor's there saying vegetarian diet can raise homocysteine, and that's bad. The other doctor's saying, well, in the short term, vegetarian diet lowers homocysteine, and that's good. How do we put all this together?
Well, one of the issues is that the plant-based diet is lower in one of the amino acids called methionine. And the research literature is quite clear that if you lower your intake of this amino acid, methionine, which is rich in animal products, you drop your homocysteine level. But what you're suggesting is that, yes, we have a lot of B12 in our bodies, and it can be stored, but if you're on a total vegetarian diet, over time you're going to lose those stores. You're going to use up those stores, and then your homocysteine level will start to rise. But you can prevent that by taking the B12 and not allowing that depletion of B12 in the storage to take place.
So the way to kind of pull this together is not only does the vegetarian diet tend to lower levels of C-reactive protein, not only does it help to lower the conventional heart disease risk factors like cholesterol and triglycerides, but this diet also lowers homocysteine. The problem is, if we're not getting B12 in that vegetarian diet, that over time will raise this problem.
Exactly. Now, one of the other issues is some of the fats that are found in the meats and in the animal products. One of these is called arachidonic acid. And it's interesting, when you get fats from the plant kingdom, the Creator has designed His foods, the plant foods, so that the fats in those foods give the body a choice. And the body can either promote inflammation if it needs to, let's say there's an infection, or it can decrease inflammation with the fats that come from the plants. But this fat from the animal products, called arachidonic acid, only gives the body one option, and that is to push inflammation, to increase inflammation. And so what we find is when individuals switch from an animal product diet to a plant-based diet, they get less arachidonic acid, and their inflammation levels also drop because of that decrease in arachidonic acid.
I mean, just as an aside, I mean, this is the same thing we find with other conditions that are totally unrelated to heart disease. Whether it's asthma, whether it's rheumatoid arthritis, oftentimes we're using a vegetarian diet as the basis for decreasing inflammation in these conditions as well. But Tim, there's a lot more to preventing heart disease than just diet. I mean, what other factors do we have to include in the program? I mean, to me, it's interesting, I mean, just as an aside, to say we started to talk a little bit about Genesis and how God revealed a program that modern medical research is showing decreases heart disease based on diet. Was there anything else, though, in that Genesis 1 and 2 account that was calculated to prevent heart disease?
Well, it states that there in Genesis that in the sweat of your brow shall you eat bread all the days of your life.
So this is even after sin?
Even after sin.
Now, I don't want any of our listeners to misunderstand what we're saying. We're not saying that God was worried about heart disease before sin. But the point is, it seems like He programmed our program, if you will,
yes.
Our lifestyle there in Genesis, and I say our lifestyle as a human race, so that we were designed to last forever.
You know, one of the things that I've noticed at the Lifestyle Center of America is if someone comes into the program and they've been on an exercise program, I kind of relax a little bit when I do their treadmill because I know that they're going to do pretty well. And at the same time, if an individual has been very sedentary, I have a higher level of anxiety about those individuals because I've seen more problems crop up on that treadmill when the individual has been sedentary as opposed to those who are exercising.
Let's talk then about exercise. What does it do for the heart? I mean, so you see people do better on a treadmill. Are we understanding anything that exercise does that helps decrease our heart disease risk?
You know, well, one of the things that exercise actually helps you to do is if you lose weight, exercise program will help you to keep that weight off.
Okay.
And we know that individuals who carry the least weight have the lowest risk of heart disease as a general rule. Other things that exercise can do is, of course, increase the blood flow to the heart muscle. You know, the Creator, in His wisdom, has given us these collateral blood vessels. They're hardwired into the heart muscle. And we know we have about 3 main coronary arteries. But there's also collateral arteries that carry blood flow. And I remember a patient back in Iowa who had 100% blockage of his 3 coronary vessels, and yet he was going about his daily activity, and he was living essentially on his collateral blood vessels. And an exercise program can actually help us develop and enlarge those collateral vessels and improve the blood flow to the heart.
Let's talk a little bit more about exercise, weight connections, and other heart disease risk factors. We're getting a lot of publicity today about the growing girth of Americans. And, you know, I think many of our viewers can relate to this. If you're like most people, in the last 8 or 10 years, you've probably put on that many pounds. If you haven't, you're doing better than the average American. But we're not here just to beat up on people and try to make them feel bad that maybe they're gaining a little bit of weight. But why is it, first of all, that weight is a problem, and then what can we do to help people? What kind of practical things can we give them that will help them be successful in shedding a few pounds?
Well, I think that, you know, if you move to a more plant-based diet, you know, the good news is that the Creator made foods that are low in calorie density. In fact, the lowest calorie...
No, wait, let's just stop there. Calorie density. Let's break that out. What are you talking about?
Well, they have the fewest calories for the amount of weight or the amount of volume of food that you're going to be eating.
So you can fill up on something and not get a lot of calories.
So the stomach, for example, holds about 6 cups. If you eat the Creator's foods and you eat 6 cups of food, you're going to get the lowest level of calories of any other food on the planet. And vegetables have the least calorie per volume. Fruits are the next lowest, beans, and then whole grains. So if you eat vegetables, fruits, beans, and whole grains as your main staples, you're going to be able to eat until you feel satisfied, until you feel comfortable, until your satiety has reached fulfillment without gaining weight.
Now, Tim, one of the things I like about you is you get right down to the bottom line. You know, I asked you for the mechanisms as well as the strategies, and you started giving us strategies, and I think that's what our viewers really want to hear. But weight is linked with so many factors. I mean, it's linked to triglyceride elevation. It's linked to lowering of HDL, the good or protective cholesterol, rises in the bad cholesterol. You know, this whole picture of clotting, blood clotting. And we need to talk about this at some point. Today's show may not be the appropriate place to talk about it, but there's a whole wealth of information coming out about factors that increase the likelihood of the blood to clot, and weight gain tends to favor those processes. So we've got this whole picture here, and diet can make a difference. What other kind of strategies can someone use, maybe they haven't been using, that can make a difference? Can they, if they choose these low caloric density foods, can they eat as much as they want, anytime they want? What kind of advice do you give to your patients?
Well, actually, many Americans are on 2 meals a day. And we're in favor of that. We actually encourage 2 meals a day, but what we do is move people forward 1 meal. So we get them eating breakfast and lunch and going to a very light supper or no supper at all.
So you're saying, by contrast, when the average person is eating 2 meals a day, maybe they're grabbing a light lunch and eating a big evening meal.
Exactly.
With some snacking in between. So you're saying the 2 meal a day program that most Americans have embraced is a
recipe for disaster.
Okay. But there is a 2 meal a day program that makes a difference. Now, I've noticed something at the Lifestyle Center of America. Many of your patients, like mine, end up dropping off that supper meal. What kind of feedback do you get from your patients about that change? Is it easy to
You know, it's amazing that people who eat a good breakfast, you know, it's like the Creator has designed his system, the human body, so that if it's fed early, if you feed the brain early, then the brain feels satisfied and you don't feel that hunger sensation nearly as much during the rest of the day, and that's what the patients report.
You know, it's interesting, when we work in a group setting, you know, people kind of feed off against one another. And when one person sees another making progress, that inspires them. You know, the message is you don't have to go to the Lifestyle Center of America or some other health center to get this kind of benefit. You can be a vehicle for change right in your own community, right in your own home. As you start embracing God's principles, physical exercise, natural diet, meal timing, getting those things to work for you, that will have an effect on your family members, your peers, your church members. It can make a difference not just for you, but for your whole circle of influence. Tim, do you find that happening as your patients go back home?
I think there's no question about that. I mean, the only thing that we have to struggle with is when we get home, the environment's different. You know, at the Lifestyle Center, the environment is fairly uniform. Everyone is doing the same kind of thing. And that's why when we get home, and before people get home, we want to encourage them to reach out for a higher spiritual help. Because without the Creator to be with you and to encourage you and to strengthen you, it's virtually impossible for some people, not so much for others, but for some people to hang on to this kind of a program, because it goes right directly in the face of our society and what's out there.
You know, this is another thing that's coming out in the medical research literature, Tim, and that is the whole issue of social support and how important this is in dealing with heart disease. You know, I think of social support happening on two levels. I think of it happening on the interpersonal level, but I also think of the social support, if you will, with God Himself. You know, I believe that God is interested, infinitely interested in your health. He's wanting to make a difference in your life. And as Dr. Arnott and I have been touching on just some of the high points of heart disease prevention, I believe God wants to touch your life and touch my life again and touch your life, Tim, and say, look it, you know, I'm interested in your total well-being. You may not be concerned about your physical heart, but not only am I concerned about your physical heart, but I'm concerned about your spiritual heart. What are the derivative spiritual benefits when we start embracing a healthier lifestyle?
You know, one of the things that I have noticed about the Creator is that He's very much interested in meeting felt needs, our felt needs. And I have discovered that if we will go to the Creator on a day-by-day basis and pour out our needs before Him, pour out our heart before Him, and listen for His voice, that He will speak things to us that will direct us to help us meet those felt needs. In other words, He'll cooperate with us. He'll be our physician, so to speak, even after we've left a lifestyle program, or if we're not in a lifestyle setting, right there at home. And so that's very important. And to me, the benefit is you connect with this Creator, your best friend, and there's a powerful confidence in that. There's a powerful strength in that. It gives you confidence to go forward to the day. You realize that someone cares about you that intimately and that specifically.
Amen. Dr. Arnott and I have been trying to share with you just a little glimpse from the modern research literature. You know, we could take all these articles, we could talk about them today. We've just touched on the surface, what's coming out in the medical research field. But what the real focus of all that we're looking at is something that points us back to this book, written centuries ago, the Bible. God's simple plan that He gave to Adam and Eve has special power for you and I today. I'd like to encourage you to look again at God's original plan, to do what Dr. Arnott said, and to ask God what He wants different in your life. You may not be concerned about heart disease or other chronic diseases, but God wants to energize your life. The bottom line is God wants to give you something, not take something away. If it sounds like God is asking you to give up something, look at it this way. How is He trying to bless you? How is He trying to make a difference in your life? Ask that question, and you'll prevent heart disease and increase your spiritual health as well.